and good to have you with us as we continue with our Friday series of conversations about mental health amidst this pandemic, the pandemic due to the coronavirus. There is also one other big fallout that we must talk about, and that is the fallout of this pandemic, the virus, the lockdowns, the isolation, the grief, the loss and death all around us, the impact of all of this on our mental health. And tonight we're going to focus on one specific thing. And this actually emerged in our conversations with the experts in the last several Friday night conversations that we've had, where they told us that they're now seeing a rise in cases of post-traumatic stress disorder, PTSD, and several other health conditions because of what people are going through due to COVID. So even in patients who've recovered from COVID, it is now becoming a bigger trend of having to then help them deal with PTSD or some or the other form of it, or even extreme anxiety and several other health conditions and disorders. So tonight we decided we're going to talk about it. If you are somebody who's gone through a very tough COVID infection, you've recovered, or somebody in your family has, and it's been a traumatic experience for all of you, then you may be seeing some symptoms of this. You may be experiencing, you may be seeing it in somebody within your own household or in your own family and friend circle. How do we identify it? How do we tackle it? That's what I want to talk about tonight. So let's say good evening to the panelists who are joining us this evening. Dr. Nimesh Desai, Professor of Psychiatry and Director at Is joins us this evening. Mahira Desai, clinical psychologist, medical researcher and co-author for Coronavirus, What You Need to Know About the Global Pandemic. Dr. Abhijit Nadkarni, Associate Professor of Global Mental Health at the London School of Hygiene and Tropical Medicine. Abdul Mahmood, founder of the Delhi-based Nehi Foundation that's actually launched a COVID-specific mental health helpline last year. Dr. Rajesh Rathi, consultant psychiatrics at Apex Clinic in Nagpur, also joining us this evening. Our phone lines are open. If you have a specific question for our experts about how to go about it, how to identify the symptoms, then do call us up and we will ask our experts to help you resolve your queries. Let me first up go across to Dr. Nadkarni. Dr. Nadkarni, good evening to you. Can you help us understand if what kind of conditions have become more predominant in this COVID era, especially for those who may have gone through the infection and recovered, or seen some kind of a tough time within the family, or even a bigger loss? What are those 2 or 3 conditions that are now seeing a rise because of this?
Thanks, Tanvi. Thanks for having me on this show. I think I just wanted to start off by saying that I'm glad that you're tackling this issue about mental health. Because and rightly so, I mean, people are focusing a lot on the biological impacts of the virus and how to respond to it. But in doing so, we are in a sense neglecting the fallout which is happening now, but also expected to expected to go on for a longer period of time, even after the pandemic ends. So you put me on a spot by asking me to tell you 2 or 3 things which are resulting from the psychological impacts of the COVID virus. I think that's, in a sense, minimizing the issue. There are several different things happening because of the effect of the pandemic. And if we look at it as a kind of a pyramid, when you talk about conditions such as post-traumatic stress disorder, or conditions such as depressive disorder or anxiety disorder, obsessive compulsive disorder, we're just talking about the tip of that pyramid. People who have diagnosable mental disorders who will require, to a certain extent, expert inputs from specialists. I think we need to be concerned about people who are at the middle of that pyramid or the bottom of the pyramid, who will probably never reach that stage where they need a specialist like a psychiatrist or a psychologist. These are people who are experiencing distress because of the pandemic, but also the things that accompany the pandemic, such as the lockdowns, which has led to a lot of people losing their jobs, worsening of poverty, children not being in schools, etc. And these are not the people we are talking about. And that is going to be the larger chunk of the people who are experiencing the fallout of the pandemic. Or for that matter, things like domestic violence. I mean, that has gone up because of lockdowns and social isolation and cabin fever resulting from the victims as well as the perpetrators being locked in the same house for long periods of time, or for that matter, alcohol use disorders and the use of heavy use of alcohol, which has gone up. So these are the kind of things we need to be thinking about, along with what you spoke about, post-traumatic stress disorder, depressive disorder, anxiety disorders arising from the pandemic and the things happening around the pandemic, but also the worsening of these conditions in people who already had these disorders and are not able to access regular services, which at the best of times they are further reduced access to it. And that those are some of the things that we need to worry about, not just the PTSD. I mean, PTSD is something that we need to worry about, but as I said, I mean, that's just the tip of the pyramid.
Yes, no, you're absolutely right there, and so much more, which is why, every Friday when we do this conversation, we pick up one aspect and then delve a little bit more. But obviously, once our viewers begin to call us, then we do speak about various aspects as well, and we'll continue to do that. But let me also bring in Dr. Rajesh Rathi on this. And Dr. Rathi, to begin with, can you help our viewers understand what is PTSD or post-traumatic stress disorder? How can it happen, and then how do we identify it?
Yes, hi Tanvi. Post-traumatic stress disorder is a disorder that we encounter, which, as the name suggests, occurs after a certain significant stress. It is usually associated with some cluster of symptoms. The cluster of symptoms being usually nightmares, hypervigilance, and flashback of the episodes that have occurred. You know, these are basically this is basically the triad that happens in post-traumatic stress disorder. As I said, flashback, hypervigilance, and nightmares. So yeah, the stressor needs to be significant as it's there in this case. As we said, you know, every loss is significant. Every life gone is significant. But the pattern in this COVID-19 scene has been something which has led to PTSD. You know, for even we know that ultimately death is the ultimate thing that is going to happen, but ultimately it requires closure. You know, thing here like people not being able to see their loved ones for the final time, not being able to perform the final rituals, you know, the sudden death. The patient has been quite okay, you know, let's say 5 or 6 days back, and then sudden deterioration of health. All these sort of things in this COVID-19 has led to an increased incidence of PTSD. Like Sir said previously, it's not just only the PTSD, as it said. There are other issues, you know, which the survivors have been grappling through. A lot of minor anxiety and depressive issues, which might not reach to the level of PTSD that we've encountered very frequently in this time. So yeah, I mean, it's there. It's significantly there, and this is something that we've encountered in our practice on a day-to-day basis. And it does require support from all sections of the society, from mental health professionals especially, to tackle this difficult phase.
So in fact, okay, so let's then say that, because we now do agree, Mahira Desai, that this is happening at a larger level amongst many of the COVID recovered patients, and anxiety or some other kind of a depression or PTSD or any other condition is now being seen at a larger scale. Do we need an organized system to deal with it? That when COVID patients are being discharged, being sent home, there needs to be a follow-up maybe with that hospital, or otherwise they need to be told to watch out for certain symptoms, and if they do see it, how to handle it, who to reach out to. Mayra, I think you're on mute.
Can you hear me?
Yes, now we can.
Perfect. So I was saying, in response to your question, yes, absolutely. With such services and such counseling, even like a brief intervention from the doctors, from the healthcare professionals, discharging patients who've had severe COVID or who are grieving the loss of a loved one, it would definitely help. But is it something which may be practically actionable currently when we are right in the middle of a crisis with already limited resources? I'm not so sure. So what we can do from our side is initiatives like yours on a show like this, where you inform the public what to expect and what to watch out for. Because not every person who's grieving the loss is going to be a case of PTSD or complex grief. There is a natural system or an immunity built in each of us to be able to healthy way cope and recover from such situations as well. However, it is anticipated with all the research currently that 30 to 50% of people who are suffering acute COVID-19 or who are dealing with bereavement or the loss of someone in these times is going through severe psychological distress. Roughly about 30% of them are likely to develop PTSD. That is what early research seems to be indicating to us right now. And we need to do what we can to have the protective factors in place for individuals to best cope with this situation. So if you have a moment or so, I could elaborate on some of those protective factors and what we are usually expecting in the grieving process, where you also need to give grieving individuals the space to grieve and mourn the loss in these tragic times.
Oh, yes, absolutely. Do go ahead, and elaborate on a couple of those points.
What we are finding is that when there is better communication with people who, with their doctors, with healthcare professionals about conditions, communications, and early strategies taken, to get the right treatment that they require, even, being aware about if right now with hospitals, people are not allowed in COVID situations. The patients are isolated, so the family members are not quite aware. So just being aware of what is happening with the prognosis, what to anticipate, better allows family members to prepare for such a situation. Also, keeping in touch with your support system, having open communication about what you are feeling. And in that direction, I think destigmatizing COVID, because even now we find that people try to hide if they have COVID or if their family members have COVID to their community. And that makes one important resource in recovering from such a situation lacking in the process. Yes, with the like Dr. Nadkarni was mentioning, with the physical distancing measures in place, with COVID restrictions, it becomes more difficult to access these support systems. However, technology is of aid, and I think that will help. I also feel that it's important for people to be aware that it is normal about 6 months as a duration for someone dealing with the loss of a loved one to cope and deal with the situation and come out of it. If you are finding, like the other doctor on our panel was mentioning, that if you are finding intrusion behaviors, if you are finding too many emotional imbalances, which are unseen, memory flashbacks, dreams, nightmares, then those are things which you can address to professionals, and I think that will allow a more streamlined way for us to get the support that is needed for those who require it.
Okay, fair enough. Is there for people who don't know too much about it and are just beginning to make themselves aware of many of these conditions and what could happen? Abdul Mehboob, are you also seeing that kind of response on your helpline? A lot of people who are calling you COVID recovered patients, or somebody who's seen an infection in their own family, have gone through a very traumatic experience and want to talk about that.
Yes, Tanvi. Hello, Tanvi. Thank you for inviting us. You see, a lot of people are calling us, and they have a different type of the problems, and certainly the majority of the people are suffering from the post-traumatic stress disorders, right from disgust, grief, wailing, and they don't know what to do, because even as a counselor, as a crisis intervention center, attending the calls, we also don't know much to do, because they are calling from different parts of India, rural India, urban India. I'll just give you that you can understand one call we got from the area of somewhere in the Jhansi, the boy who is the MCA, and his father died. And still persistently, he's suffering from so much acute depression and the grief and disgust that he could not save his father, because his father died due to him, because he contracted the infection and that got transferred to his father, and his father died. It is very difficult because he's a rural area. There is nothing to go. Even we advise that you get someone homeopathy, even who can give you some medicine. It may help you. But every second day he calls and he's not coming out from that whole feeling of the uncomfortability, and he gets often depressive bouts, and then he calls in the midnight to our helpline. So, and there are the hundreds of the call. We can understand. One may say that this is situational, it may has happened. One thing I'd like to tell you, Tanvi, because before the March and the last year, the nature of calls was totally different. But onward March, when the second surge has taken place, the nature of the calls and the callers totally different. Now that you can think about, a caller is calling to you that, look, I have to get my father terminated, but I have been given token and I have to wait for 4 days, 3 days. What you will call to that person? What you will do in the counseling and then crisis intervention? Where is the any psychiatric help available to such person? So there are so many, and I'll tell you, the number of the suicides have increased like anything. Our experiences of last 25 years say that we hardly used to get less than 1% suicidal calls. But last 1 year, we have got around 6.07% suicidal calls. It's mind-boggling. Recently, one relative called, said, look, my daughter have left 2 children. Her husband died and my daughter died. What I will do with these children? Where I can go? I myself is a poor person. I could not give a good funeral to my daughter because we didn't have money to do that. In such a situation, when a father is really weeping on telephone, what he will do? So the situation is alarming. We can't believe, because what is visible, it is only physical health suffering vis-a-vis the COVID. But what is the suffering? Nobody is seeing that the mental health. It is another epidemic. We have been saying that, look, we are passing through 3 epidemics. One is the pandemic of the COVID, another is infodemic, and third is the mental health epidemic. It's huge, and there is nothing to do. Even the last year, I remember when there was a lockdown, a lot of people who have already mental health issues, they were on the medication, getting the medicines from the hospitals, or they were not getting medicines. Even they managed money, the shopkeepers was not giving the medicine because they didn't have the prescriptions, the latest prescription. So the situation is very different altogether, and the different phases. Students are suffering like anything. We get so many calls from their students. In last 1 year, we have got more than 1,500 calls from their students. Around more than 23% of the total calls. We have received 6,319 calls. So this is the situation. But unfortunately, there is no support. Of course, we are there are the few organizations who came forward. Last year, NIMHANS also launched a helpline. Ministry of Empowerment also launched a helpline. Many organizations came forward. But unfortunately, those helplines are not effective till now. We refer to many people, why don't you call over there? And the organization who are running the helpline, they themselves crumbling pressure. They don't have any financial support. They don't have a manpower. We started with 20 voluntary counselors. Now we have left with only 5. Now we are looking to recruit new counselors to train them so that they can take calls, the rising number of the calls. We don't have facilities of the many lines. We have only one helpline numbers. How many calls you can attend in 12 hours? We don't have a means, we don't have a human resources. And this is the situation of every organization in this country, those who are running the helpline.
How much, Mr. Mahmood, would you said that there is a significant increase in the number of calls, and also, the kind of calls that you're getting are more intense right now. How much more are we really talking about versus what you would have seen in the lockdown time last year?
It is, look, the question is that last year in lockdown, the callers has economical issues, they have their survival issues, they have anxiety, a lot of anxiety and fear, what will happen tomorrow, how I will pay my bills. And this year, I'm telling you, the nature of the calls is totally different. I remember one person called that, look, I have a bag full money, but no hospital is admitting my brother. Where I can go? Can you help me? Can you tell me? Such calls we are getting, and you can understand the person was really weeping. He said that I don't have money. He was saying that, look, I have earned so much money, but today I'm realizing this money is no use. My young brother is not having, I'm not getting oxygen. So the question is that there, at least there is no someone to listen to them also. There's not someone listen to them also. So the issue is that in such a situational post-traumatic stress disorder, people are suffering. There should be the hundreds of the helplines set up by the hundreds of organizations. Each hospital should have set up. They have, many hospitals have psychiatric department. They have the psychiatrists. They have psychologists. They would have certainly set up like that, the way Nimans has set up. But nothing much has been done here. I'm telling you that.
This has to be done at a larger level, Mr. Mahmood, not just individual organizations, hospitals, schools, and we've had specific series and episodes where we've only spoken about children, youngsters who have their entire future currently hanging by a very thin rope because of the pandemic creating havoc in all of their plans. Corporates need to do it at their own level as well. And provide these kind of options and solutions, and somebody who can just listen to you and guide you if there need be. I was looking at a study that was reported by many international institutions, something that was published in the Lancet journal, and a survey that was carried out that showed that 1 in 3 of the COVID-19 survivors in this study, which is over 2.3 lakh people, mostly Americans though, 1 in 3 of these people who were surveyed were diagnosed with a brain or a psychiatric disorder within 6 months. This suggests a larger wave of mental and neurological problems that are being reported, and similar studies, I believe, have been done in many European nations as well. Dr. Nimish Desai, good evening to you. Any insights on what India is witnessing? Of course, we are a lot lesser in terms of our reach, visibility, even talking about mental health. But how is India doing in comparison to the others?
Yes, Tanvi, thanks. Thanks really for your consistent interest in mental health and the episodes. Let's realize that, first of all, in the background of a society where by almost all sections, mental health was not on priority, as you have been emphasizing. In that background, you have had a cumulative stress of a year, culminating into now in the second wave of a tsunami of traumas. Now, that's the overall situation that we are dealing with as of now, and we try and predict how it's going to turn out in the next few months. The first thing is that, for sure, like you were saying a minute ago, there's a lot of helplines, there is a lot of offer of help. One must also differentiate between information helplines for COVID information vis-a-vis helplines for logistics and the counseling or mental health helplines. I must say with all respect that there is in many domains a lot of confusion about this, especially about the data. I said that to address your question. Let's face it, and I'm so glad you mentioned about the European data and whether the Indian data would be different. Global figures for prevalence of psychiatric disorders is 1 in 4 persons. Indian data is 1 in 10 persons. So while we surely need to recognize that mental health at every level of psychological distress, of acute stress syndromes, of long-term psychiatric disorders in all groups of the society is going to be requiring attention, let's also be sure that including PTSD, the rates in the Indian and South Asian population is fortunately very low. Now, here is a bit of a paradox. Our health systems are kind of fledgling. Our mental health systems have been robust in parts, but they are again not attended to in this period. On the other hand, the community and the social support systems actually seem to help the resilience. And so we have a very delicate task of encouraging positive mental health by community and social support systems for large groups of communities, maybe only by informal or semi-formal help, and at the same time, from micro to macro level, identify those groups and persons who require professional help. Now, in a country like ours, in the background that I mentioned, that is the most difficult task. Allow me to also share, Tanvi, about the PTSD debate. I'm really focusing on PTSD. Globally, it's very clear about PTSD being about the result of one or more trauma, individual or group. The fact is that there is a lot of research in last 25 years, from Latur earthquake to Gujarat earthquake to tsunami of 2004 and a few before and after that, some of our own research with ICMR and WHO funded, which clearly establishes that the rate of PTSD is not nowhere near as high in our cultures as it is in the US or in US and Europe. Let me quickly cite an example. ICMR and we did a study in Gujarat earthquake, getting into the field within the first month of the earthquake, followed up for 9 years, 35,000 population. Almost no PTSD in the long run. So let's realize that while PTSD is a predominantly American economic concept and scientifically does translate to a lot of situations of severe trauma, we in this culture need to look at our responses very differently. Like my friend said, offer counseling and support, strengthen community support systems, improve and strengthen the existing mental health systems to deal with the problems that they reach. See, one of the very difficult things that we established also in tsunami is what I call as the reverse flow. Governments and agencies tend to send out teams of experts to those affected areas or to affected population, whereas people who have psychiatric problems, previous with recurrence or relapse, or new ones, actually need specialized services. But that's only the tip of the iceberg still. There are 3 levels that can be clearly identified from disaster mental health that apply here. Those who have not had COVID infection at all, or who have had mild or asymptomatic COVID infection and gone through. Those who have been through COVID experience themselves, lost people. There have been, as we know, there has been a lot of loss of lives that can be very traumatic, or who have had the experience of help seeking being very difficult. And those who have post-COVID psychiatric syndromes. Now, we really need to, and allow me to say, the NHRC and a few other agencies have actually been doing this. The NHRC actually has a layout plan for mental health care services. So with all the effort that all my colleagues said we make, if we can have a slightly nuanced approach, allow me to say, rather than merely following the Western models, that will work out so much better. In the end, for sure, as you and I have discussed enough, if we as a nation lose this opportunity for focusing on mental health and strengthening the mental health systems, history will not forgive us. This is possibly the last opportunity that India and South Asia have to improve mental health systems. But I must underscore again and again, in a calibrated, appropriate manner to our situation, not following the Western models.
Okay. Dr. Rati, would you like to comment on this in a calibrated approach that we should have? It should be unique to what we are facing. What should that be?
Yes, definitely. As Dr. Desai sir said, he's a stalwart in psychiatry himself. The mental health part is grossly neglected in these situations. There is definitely a need of proper mental health helplines in this situation to make people aware of it. All the sections of the society need to come together. There have been a lot of cases which people are unaware of what is happening. Obviously, many of the situations arise because of the external stresses, of COVID, like financial burden, like loss of a loved one, difficulty in getting to day-to-day life chores that previously people used to. But a lot of it is internal also. I mean, there's a lot of research left on that front, but slowly we'll realize that COVID by itself has some direct effect on mental health. And the number of cases which I'm sure all my colleagues and mental health professionals and in other fields must be encountering is significant. It's significant. Maybe this can have an impact on the long-term issues in facing things. These issues are usually chronic. So it's very, very important, as Dr. Desai said, that we do not neglect mental health at this time. It's important that we do something so that we diagnose the issues as quickly as possible. We make people aware of all the symptoms regarding it. PTSD is still a major diagnosis, but here important is not to neglect the minor ones. While we all know about grief, and the periods of grief and the stages of grief which are normal, denial, acceptance, depression, which happens when we encounter any significant stress. However, we don't realize when the grief becomes complicated, when the grief does not remain just grief, but it turns out into some mental health issue. And while it would be wonderful if we can sort of diagnose such issues and help such people who go through them at appropriate times, and it can only be done through an integrated approach of all the professionals in the society, and hopefully we'll be able to help them in such situations to tackle such difficult situation in a better manner.
Okay, interesting that you say that. Before we talk a little bit more about what our response should be and how we should approach it, Dr. Nadkarni, I wanted to ask one question as well. In globally, what we've seen in different countries as well, when do these conditions develop? From the time that you've gone through a tough experience, a COVID experience, could it be 1 week? Could it be 1 month? Could it also be longer than that, 6 months later, 1 year later, when you actually begin to see that something is impacting you and some symptoms are showing?
I think, Tanvi, when we try to get into these mathematical algorithms of how to define mental health problems, which by themselves are pretty controversial within the field, like is it 2 weeks, is it 3 weeks, is it 1 month, is it 6 months? I think we are doing a disservice to the distress that people experience. So, for example, if the diagnostic categories say that if you have X, Y, and Z symptoms for 2 weeks, you are diagnosed with a particular condition, what happens until day 13? Does that person not have that distress until day 13, and suddenly on day 14 that person becomes someone with a mental health problem? It's not a binary. So I would be loath, and absolutely, I mean, it's not in line with evidence as well that we should be talking about these things. What we need to be focusing on is people's distress. If someone is expressing distress, then we need to respond to it, whether it's 2 days down the line, whether it's 6 months down the line, whether it's 1 year down the line. We should not be caught up with these diagnostic categories. There are flaws in these diagnostic categories. There are limitations to these diagnostic categories, as Nimesh pointed out about PTSD. We need to be focusing on the experiences of people. If someone is coming and telling us that I feel extremely anxious, I am not able to sleep, I get palpitations, then we need to respond to those rather than trying to focus on these, to a certain extent, artificial categories that have been created.
No, so I actually didn't mean it from a very mathematical point of view to say this will happen only within the first 2 weeks and not after that. More from the point of view of often we don't realize but the trigger could be much later. We could only maybe realize it a year later. The problem may become grave enough and intense enough for us to only realize it much later, which is why people need to be aware of it and need to keep watching out for how they're handling it. And correct me if I'm wrong, Dr. Nadkarni, but everybody handles it differently. Now, if it's a fight or a flight kind of a method during the trauma, after that, how you handle it how much do you address it or not address it, or put it aside or suppress it, and at what point do you deal with it and how you react to it could be different for different people. So it is important to know that it could hit you much later.
Yeah, I think so. So that is probably the key and only message that needs to go out. That is the psychological or emotional impact of what you have gone through, either as someone who has become COVID positive, or who has been a caregiver, or who has been impacted by all of the other things happening in society around the pandemic, that the psychological and emotional impact of that could happen at any point in time. I think if there is only one message that needs to probably go out from today's program, and if you say there's only one message that we can give, I think for me the most important one is this can affect your psychologically or emotionally at any point in time, and so you need to be mindful of any of the symptoms that you could experience because of this.
Okay, let's take it a step further as well, and I want to maybe cite an example and then build on it, Dr. Desai, for more people to be able to connect with this situation. That many of our acquaintances or loved ones who've gotten COVID, who've been in hospital, especially this time in the second wave, where it was a tsunami of cases, and anybody who was in the hospital would tell you that all around them there were people in various kinds stages of COVID, various stages of pain, constant news of serious cases coming in or people dying in and out, constant noise, and all of that day in, day out. When you hear this and you're away from your family, you can't meet your family, you're just in that room, perhaps with 4 other people, 4 more outside in the corridor, another few waiting for their chance to get a bed. That will leave an impact on you. Now, what should be the approach to handle this? How do you process this internally?
Thanks, Tanvi, again. As you beautifully outlined, there is a series of traumatic situations that the populations have gone through. Some of them, my friend Dr. Rajesh Rathi also enumerated, from the actual infection and its biological effect on the brain, to mind, to the psychological effect, the direct experience of health utilization being saved despite possibilities, and of course, not the economic fallout and the issues. To my mind, effects of that are going to actually be seen in next few months. But to answer your question about how to handle it, one, be alert to picking up any symptoms of serious depressive disorder or acute stress disorder, or rarely PTSD. So being alert, as my friends I think said, being alert to picking up episodes for those who require professional help. 2, can we try and maintain a positive atmosphere in the society and individually in small groups, try and maintain thought and positive mood state? Allow me, Tanvi, what I was doing in the last few minutes is I have written down a few do's and don'ts that I think would apply to, again, individual at micro level, to families and groups, to organizations, to the larger society, including us in the health and mental health care systems. Firstly, the don'ts. Easier said than done, but worth doing. Not to panic. Not to overdiagnose or not to diagnose too early. Most importantly, not to medicate with psychotropics where it is not required. Psychotropics is a huge double-edged sword. It does wonder require it. It's totally avoidable and potentially harmful if it is done early. And there's very good data, again, this internationally and in India, to suggest that early overdiagnosis and early and long-term continued treatment with psychotropics is a huge danger in disaster and epidemic situations, driven by people's own anxieties, the family physicians, the health systems. The do's, like I said, be alert to picking up symptoms, be watchful, pick up signs. Most importantly, maintain mental health services for those who were using it earlier and who might need it now. And really, to my mind, most crucial, while strengthening mental health systems, increase access to mental health services. Let me also point out here, Tanvi, you might know this from our earlier discussions. The treatment gap for diagnosable mental health problems in this country is 80%. So out of 100 persons, hypothetically, if there are 10 people who have diagnosable mental health disorder and who require and deserve treatment, till now only 2 out of those 10 or 2 out of those 100 have been getting it. There are 8 out of 10 or 8 out of 100 who did not reach mental health services. So to reduce that treatment gap, and for those who might need it new, increase access to mental health services. And again, I must mention here that the telemedicine guidelines and applied to tele-mental health besides counseling, I'm talking about tele-psychiatry or tele-mental health services, including prescription after careful watch. One of the ways of increasing access, besides every other recognized strategy, which has already begun to happen, but I think we need to do much more, is tele-mental health services by government, public sector, by private sector, and NGO sector.
Okay, telehealth services as well, where we would need representation or at least work being done and some amount of push even coming in from the governments, not just the NGOs which are there. Let me now go across to some of our viewers, and I'm told a couple of them have been patiently waiting on the phone line. Mr. Kirit Joshi is on the phone line calling us from Delhi. Good evening, Mr. Joshi. What would you like to say? Okay, we're going to try and patch him back. Let me just bring in Asha. Asha is calling us from Mumbai, one of our regular viewers. Good evening, Asha. Go ahead, please.
Yeah, good evening. I know you guys are talking of mental health, but the problem mentally starts with us the moment we know we have a situation like COVID, which is nearly 2 years now. So the health, that means we worry about finances, we worry about being alone, we worry that the doctors are struggling and dying, we worry that when we go home, when we are poor, we walk home, that our families may live or not live. We worry that how will we conduct the last rites. We worry whether the soul has gone to heaven. We worry. The health starts then. Finances is the first problem. You must understand that you have got rid of all the NGOs. The Prime Minister sits alone when he's talking with the states. Why doesn't his group sit with him? Where are people from the government, the MLAs and the MPs on ground zero? We are losing doctors. We don't have doctors. You have not conducted enough research. Our worry is never ending. It's not mental health of the rich, it's the mental health of the poor, of the nation. We pray every night that please God help us live. What is this? And
right.
There are no helplines. There are no helplines. All the panelists have given no helpline. How are you going to give it on the phones? This is wrong, Tanvi. I congratulate you on what you're doing. But let them talk less and answer more.
Right. I get the point that you're making. Thank you so much, Asha, for calling us. I believe Mr. Kirit Joshi is back with us on the phone line. Mr. Joshi, good evening. What would you like to say?
A simple problem. I am 86 and I am in Delhi. Yeah, I am in Delhi. Jai Hind. I am 86. I am in Delhi. I have a couple of issues. I am physically fit. I do my exercise. I do my yoga, all these things. But lately, you see, I am having severe headache sometimes on both the sides, sometimes in front, sometimes in rear. And there are some issues which are worrying, which keeps roaming around in my mind. I just can't get rid of these ideas.
Okay. There are certain thoughts that you say, Mr. Joshi, you have in your head, and because of constantly those ideas, you are also now getting headaches. Is that correct? Did I get that right?
Yes.
Okay. Let me see if any of our experts want to come in here. Mahira, Mr. Joshi also, in the conversation with my team earlier when he first called, said that there is a lot of stress around constant bickering that happens, with some of the people around as well. That's adding to his worries. He's 86 years old. He also has diabetes.
Absolutely. Thanks, Tanvi. What Mr. Joshi said, what Ashaji was mentioning, are concerns which we hear all the time from people we know, from people we talk to, even in a professional relationship. And these are concerns which each one is echoing. It's important to acknowledge, like Dr. Desai was saying earlier, it's important to acknowledge and be aware and create a healthy space where we can share and discuss these issues. If I were to say somatization, sometimes headaches, worrying, tends to sleep disturbances are also seen often as manifestations of stress when it's getting very high. How can we manage this? How can we deal with this? I'm going to give one quick recommendation. If just allow me a minute for that. We all think about all the things that concern you, that worry you, and put it into one big bubble and call that the bubble of concern. We all are concerned about what's happening in the country, what's happening with our healthcare workers, what's happening in our personal life, what's happening to our family who's in the hospital currently, right? Our doctors who are going into the hospital. So that's our bubble of concern. However, for most of us, within this larger bubble of concern, we have a smaller bubble of influence, which includes the things where we can do something about it, which may potentially affect the outcome of the situation. Within that is a smaller bubble, and that is your bubble of control. Within that bubble of control actually comes only three things: our own thoughts, our own emotions, and our own actions. And we notice this often that the more we spend time and the more we tend to find and focus on our bubble of control, the more empowered we feel in a given situation. Yes, I agree not to discredit any of the concerns that they have raised. There are a lot of things which are worrying us, which are alarming us. However, the more we look at an immediate level where we can provide help, offer services. In fact, I'm going to go ahead and say altruism is known to be a great preventive measure. It's known to also boost good mental health and coping mechanisms. So in situations where, see how you can make the difference at your individual level. When Dr. Desai, Dr. Rathi were mentioning about creating a community level of intervention, a community level of mental health services to provide, we can create what we call buddy systems within our own communities, with your neighbors, with your friends. Keep a list of 5 of you all who are going to keep checking in, especially for those who are vulnerable. And these discussing, talking, sometimes just being heard helps one feel better. And if despite that we do not feel better, they continue to persist, a mental health professional services are available, and tele-services are today allowing access to the most remotest parts of the villages. In our book also on the coronavirus, we did mention that a mental health pandemic is coming. Just to add, even with the SARS or the MERS of 2002-2003, research indicated that when do we experience these issues, how long can they emerge later? They can emerge even up to 3 years after the epidemic was over. In those who were closely linked to it, there were cases of PTSD, depression, alcohol, substance abuse. So this is within Southeast Asian culture. So this is what we have to look out for. How else can we help with the intervention? I would suggest, again, Dr. Desai was mentioning about the Indian scenario, about the Bhuj, earthquake that happened. Research, my co-author on the book, Dr. Rajesh Parekh, had done research over there, and they found that as you are closer to the epicenter of the earthquake, those at highest risk are there, and as you move away from the epicenter, the risk and the incidence of mental health struggles reduces. So I feel that could be one direction. We could learn from that as a direction that over here in India as well, where are the epicenters or the most severely affected areas, we find a way to provide services, starting at a very body level, community level first, and then building on to that, so that the psychiatrist, given the limitations of the number of hours and the number of people one can possibly see, are reserved for those who need it the most.
Okay, fair enough. And I think because, the way our societies and our communities are designed, it would be perhaps, easier for us to make that the first step, to say, let's build our support system around us as the first step. And then if there is need, then you move ahead. Let me just go across to one more viewer on the phone line. Rohan's calling us from Jaipur. Good evening, Rohan. What would you like to say?
Yeah, hi. Good evening, everyone. Yeah, so I just wanted to mention a situation, and it is quite related to what Mahira Desai was talking about. So I was actually detected COVID positive around 20 days back, and I have a family, my wife, my small kid. So that actually I recovered, and I'm now out of isolation and everything. That has impacted my wife a lot mentally. Now, because she is now in that state of mind that, now, okay, other family members were safe, but now what I have to do, can it get to us again? And all those things are, troubling her mentally, and she's not, able to sleep properly. And, and all those thoughts are coming that, okay, if I get infected, who would take care of the child and all those things. So how to address that, these kind of things like which happens with family members, all that.
Right. Okay. Dr. Desai, would you like to take this up? Of what Rohan is experiencing in his family is what many of us would be going through, the anxiety and fear of more infections and what happens next in the future.
I'm sure I speak for all of us here, including you, Tanvi, when I say that all the three callers have actually given us accounts of their anxieties and difficult situations, which it so happens cuts across different situations and age groups of the society. The point that I want to make, besides expressing serious empathy for all of them, is twofold. One, Asha's narrative was actually very emotive. And the fact is that if an individual or a family is going through all those hardships, at that stage, I completely agree with her. This talk about mental health and psychiatric disorders might mean little to her or them. It's been again well established in disaster health research and disaster relief that health or even mental health issues figure and are handled better once the basic needs have been taken care of. Now, fortunately, that is what happens when you have isolated, well-defined disaster situations. Here you have a global pandemic where the economic factors and the social situations is going to happen a lot. And so relating to what Rohan said, and all three of them, including Joshiji, I would like to offer whatever we can do in Delhi, please tell us. But my heart, I'm sure, goes out, all of us, our hearts go out to these three people who represent millions. But the good news, and to the extent that it may help, positive thinking and positive approach helps, because the macro reality, my friend Rohan, is that majority of the people initially for a few weeks or at best for a few months will have these disturbing symptoms. I'd like to say something here about, Tanvi, what we did in what's called the National Disaster Management Authority about a decade ago. When we were developing national guidelines for psychosocial care and mental health for disaster and epidemic situations, all the experts and research from all over the country got across for over a year. And a lot of conclusions that we had. One of the most important was that the initial few weeks and months of any such situation, almost every psychological or behavioral reaction be considered normal unless you have very good evidence to say it's a disorder. So the slogan that we really have liked is normal reactions to an extremely abnormal situation. Now we all know this 2021 has been even more, 100 times more than any extreme situation. And so my message to all these three colleagues and everybody would be,
correct.
Research as well as the Indian evidence on resilience shows that most people will do well if you can please go through this period of anxiety and all the worries as best as you can on your own with local help. Again, to say again, for sure, look out for definitive signs of a disorder that requires professional help. But let's not over psychiatricize the society while we need to increase mental health awareness.
No, you're absolutely right, and we shouldn't. And yeah, already, let me just put it this way: already there is so much of worry, there is so much of grim news all around. And just when we thought we were done with the, with COVID and the lockdowns, came the second wave, and just when we now see that we are trying to get a hold on it, things are getting better. At least our healthcare infrastructure is much better than what it was earlier. There is now more and more news coming around about black fungus and other kinds of complications that are emerging. So there is so much of grim news. People have gone through tough times. There is fear and anxiety of more infections and about your future certainty, education-wise, jobs-wise, all of that exists. But we can get through it together and things will get better. And if they don't individually for you or for your loved one, then continue to, reach out for professional help to see how you can tackle it. On our part, we'll continue to having these conversations every Friday. This is my promise to you till we get through this pandemic. Thank you so much to all of our panelists for joining us on this conversation.